Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show. Today we have a very fantastic guest with us. Please could you introduce yourself to us?
Hello everyone, I'm Dr. Cassie, currently working as a medical officer currently in Rivers State.
Okay, so Dr. Cassie, thank you for joining us today. We're going to talk about STIs and STDs. What are STIs?
Okay, just as she already said, sexually transmitted infection or diseases, as the name implies, are infections one can get from engaging in sexual activities with someone else who has the infection. These infections can range from bacterial infections to viral infections, as well as parasites as well.
So in Nigeria, are there common sexually transmitted infections? And could you tell us more about them?
Oh yeah, there are quite a few, if I would mention. But like in this our society here, starting from the bacterial infections, we have stuff like chlamydia, we have gonorrhea, we have trichomonas, as well as going to the viral aspect. A well-known one is HIV, which is human immunodeficiency virus, and then we also have herpes, and then going off to the extreme as well to some other infections like syphilis. These are like, to just mention a few.
Okay, so you mentioned chlamydia, gonorrhea, trichomonas, HIV, herpes, HPV. Could you tell us more about these infections? So the symptoms that we are going to face or one is going to face if they have this infection.
Okay, so in the bacteria, as you've already called, like the chlamydia, gonorrhea, and then syphilis, these infections, like usually most of them present with no symptoms. The norm is to have no symptoms, to be asymptomatic, which is presenting with no symptoms at all. However, as those that do present with symptoms, they have things like, okay, you have like discharge, like in a lady, you have people complaining of vaginal discharge. You have them maybe having intermenstrual bleeding when it's not your menstrual period or cycle. Okay. You can also have pain with sexual intercourse, or even itching, or as well as even more severe symptoms like maybe impairment in your sexual activities as well.
Okay. So we've talked about the symptoms someone is going to see if they have these bacterial infections, right? What about viral infections such as HIV?
Okay, for HIV, that can be a bit tricky now because usually when someone gets infected in the initial phase of HIV infection, there's usually nothing so specific that would draw your attention to it because it presents as simple as a flu-like symptom. When I say flu-like symptom, I mean stuff like you can have like a mild fever, you can have a sore throat, you can just feel tired or even fatigued. It's something that people might just normally say in our own climate, they'll say it's malaria and then just go and take some paracetamol or something to just calm them down. So it can be very non-specific. So eventually, as you go down the line with HIV, as you already mentioned, it progresses to what we call AIDS, which is acquired immunodeficiency, whereby the HIV, the virus itself, attacks your immune system and causes you to become more susceptible to infections that usually you wouldn't be susceptible to. So to name a few of the things that are commonly seen with HIV patients now, you know TB, which is a common thing that we all hear. Oh, someone has TB, tuberculosis. It usually will present with stuff like cough, or someone having like a chronic cough, not just any cough. Before people get scared now, not any cough, just a chronic cough usually is dry, and then you have like a long period. When I say chronic, I mean a long period, like for weeks to months
of coughing.
Of coughing. You have excessive night sweats, you have weight loss, and then you can progress to, like, depending on your immune system, the aspect of your body that the infections are, like in your GI now, your digestive system. People can have chronic diarrhea, just having watery stools for a prolonged period of time, which is not a norm. And then normally, at least what I know, people with HIV, they'll just say, oh, someone has lost significant weight. They'll say, oh, someone has HIV, but that's not always the case. But that can be a presenting symptom. You can also have neurologic symptoms. When someone becomes more susceptible to infection that they will never usually present with symptoms, they will now have like neurologic complaints like maybe visual changes, some mental presentation, like presenting with some psychosis, behavioral changes, psychosis, a wide range of things depending on the system that is infected. So as your immune system gets depleted, you become more susceptible to things that you wouldn't have been susceptible to. That's generally the summary.
So we know the common STIs in Nigeria.
Okay.
What can you say is that people can do, or that people do, that predispose them to STIs?
Okay, so the risk factors to, just like the name sounds, sexually transmitted, is definitely engaging in sexual activities, but not just any sexual activities. Like, with first thing on my list would be having unprotected sex. Sex without using like the barrier protection, which is condoms, which we all commonly know.
Yeah.
People that don't use condom predispose themselves to easily getting this infection, because once you have contact with someone that has the infection, there's a very high chance of you also contracting the same infection. As well as people that have multiple sexual partners. Now we have like a wide range of partners, and you cannot vouch for them that, oh, this person is possibly like, someone that...
Monogamous just to...
Exactly. So, exactly.
No, we cannot that be. Oh, wow.
Of course, I'm not saying that, but it's just having multiple. You can't really tell.
You should not have multiple bases.
It's a risk factor. So
what if I want to have multiple?
I can't help you on that. So also you have like people, like young children, like people that actually engage in sexual activity at an early age.
Adolescents.
Yes, adolescents and teenagers, because normally, because of, I'll say like people are not really enlightened at that age on how sexual practices should be. So they would be less aware of using barrier protections, like I already mentioned earlier on. So they will actually have more risky behaviors and then partake in some safe sex practices. So they are at increased risk. Also, people that are like sex workers, because obviously they'll have multiple sexual partners. So people that take alcohol and drug users, because they are also at risk, because they actually engage in like high risk activities. So it's possible that they can also engage in some sexual escapade. That
so you're saying that basically, as they are taking alcohol, you're using drugs, you're not in your right frame of mind, right?
Yeah.
So you can be making decisions that will be harmful,
irrational decisions, and just do things that are more risky than someone that is in their right state. So also you can have as just people that actually engage in also like unsafe sex practices, like normally people risky sex practices like anal sex is not the usual, but people that engage in that, they are increased risk, because that area is quite sensitive to
injuries.
Yes, injuries. And then when you have injuries, it increases the chances of any infection getting into your bloodstream and causing you to have the infections.
Okay. So when you're saying this risky sexual practice, you're saying having just basically unsafe sex with multiple people, or even with one person, but still unsafe sex.
Yes.
Okay. So can you tell us about the management? Or before that, can you tell us, okay, how do we prevent? Now we know the risk factors, right? How do we prevent getting...
Okay, so prevention would just be similar to attacking the risk factors, which should be like, first of all, you would like to educate everyone on safe sex practice, which is using barrier protection if you must engage in sexual activities, keeping to one sexual partner if you can, as well as doing like routine and regular checkups in the hospital, because like I mentioned earlier on, some of these conditions, they are very like quiet, that you don't present with symptoms. So if you know your lifestyle and you know you're engaged in these activities, or you don't trust some of the people you engage in these activities with, it's also good that you would subject yourself to at least routine screening and testing to tackle it at the early stages, so it doesn't progress to something worse.
Well, a lot of people, when they say they don't go for testing because it will portray to the partner that they are cheating on the partner. What do you say about that?
Oh, well, I would say like in the health facility, there's something we call patient and doctor confidentiality, whereby you have access to your doctors and you don't need to disclose, no information will disclose to any other person around you without your permission. So I don't think that should prevent people from checking themselves in the hospital.
So let's say a person finds out that their partner has gone to check. They feel that means their partner is cheating on them.
Oh,
I think it's like just a stereotype we have.
Okay, well, I would say that wouldn't be the case, because like I said, it's not just from having multiple sexual partners. There are other unprotected sex with your own self, like with someone else, that just has the infection. Maybe it can be caused from, like in HIV, there's a possibility of having it gotten from what they call it, the
Blood transfusion.
blood transfusion.
Okay.
Or from
like a needle.
Yes,
sharp object.
and then if you eventually engage in sexual activities with your partner, it can be transmitted. So it's like I said earlier on, educating them on all these extra curricular activities. I was saying.
Let's talk about the management. So let's say someone is suspicious. What do you do? What's the first thing you should do?
Well, I would advise you visit your healthcare provider, first of all, because that's where at least you'll be educated and then be enlightened on what is happening around you. And then there are also treatments that are available for all these infections. Like most of the infections, not all of them most of them have like a cure. For the bacterial infection, like I mentioned, chlamydia and gonorrhea, they can be treated by simple antibiotics.
Okay.
Syphilis, true, treated with simple antibiotics. HIV is more like a chronic condition, but there are medications that have been made that are very effective that will lead you to have a normal life and without even presenting with any symptoms. But the key to that is early detection. If it's detected early, then there are things you can do to prevent you from progressing further. With the herpes, which can be a bit more, it's also a chronic condition that people don't really talk so much about, that would present usually with painful sores in your genital parts or in your mouth or your lips area. If you have those things, there are antiviral medications that can reduce the duration of the symptoms. And then you also have regular checkups that will also like help contain the infection to be in a stable state as well.
So when you go on the street, sometimes you hear people advertise things. They cure malaria, they cure gonorrhea, they cure syphilis, they cure HIV. What's one bottle?
Okay.
What are you telling us now?
Please, like I
should
said,
not purchase this.
no. Educating the public on this is important. That's why we have this show, Healthy Happy Humans, to educate them and enlighten them more on where to get their care.
Thank you very, very much, Dr. Andre, for joining us today and for talking about this topic.
It's my pleasure.
STD. Okay, so thank you for this very exciting episode. Please subscribe, follow our YouTube channel, follow us on all our social media handles, Twitter, Instagram, Facebook, and please click the notification bell so that you can always get the videos as soon as they drop. Okay, leave your comments down. We would like to interact with you. Thank you.
Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.